Good afternoon. We're certainly glad to have you all here with us today. And most importantly, we're glad to have Senator Blumenthal here with us to discuss a very important issue that's impacting many in our country. And so, Senator Blumenthal, thank you.
Thank you. Thanks, Bill. I'm really proud to be here with Roland, the Governor's Prevention Partnership, with Ruth, and with two great spokespeople. And what they had to say may be most important. But I want to talk a little bit about a cause that has preoccupied me for most of my time in public service, which is nicotine addiction. Nicotine addiction. Whether it's tobacco or e-cigarettes or even some of the opioid and fentanyl problems, what we have is substance use disorder as a major cause of social and personal turmoil and chaos in this country. A lot of people think that nicotine is harmless just because it's legal, but it's a drug. It is probably the most highly addictive drug, at least most highly addictive drug that's legal in the world. And what vaping does essentially is addict young people to nicotine and provides a gateway to other drugs, addictive drugs, whether they're nicotine and tobacco or illegal drugs. So what we've seen in this country is a burgeoning use of vaping products. I'm tempted to call it an epidemic. The word epidemic is overused, but we see in the United States of America an e-cigarette and vaping epidemic. The exact means have changed. Now many of the vaping products are disposable, although more than half are still refillable. But the basic principle is the same. Nicotine addicts. It's a gateway to more seriously illegal addictive drugs. And maybe most important from a public health standpoint, it is certainly a gateway to tobacco and smoking. What we need to do is recognize the problem. There's been a 47%, there's been a 47% increase, 47% increase in just the last 2 years in the number of teenagers using vaping products. 47% more. So that now 27% of all high school students, that's right, 27% of every kid going to high school is vaping. As kids go back to school just days from now, vaping will be in the bathrooms, in the classrooms, and even in the locker rooms, because it is burgeoning. In the COVID years, it was ignored because we had more serious public health issues facing us, staring us in the face. But vaping now is back in even greater numbers and frequency. We need to recognize it and also recognize why it is back so heavily. And that is, the vaping companies are taking a page from Big Tobacco's playbook. They are pitching to kids. They are using flavors: mint, bubblegum, blueberry, raspberry, menthol, all kinds of flavors that make vaping more attractive to hook kids and then addict them. That's the MO, that's the playbook. They are adopting it from Big Tobacco, and they are doing it simply because it's all about the money. It's all about the money for vaping industry, for e-cigarettes, and the use of liquid nicotine, which, by the way, can poison kids. One of the great dangers of vaping products is that they often use liquid nicotine, which can poison kids and does for many kids every year. They're taken to the Poison Control Center, emergency rooms. So it's more than just about long-term addiction. There's also an immediate public health threat. I've written to the FDA demanding action. The FDA was supposed to act under a court order 2 years ago, literally, September 9th, 2021. It was supposed to issue rules that could better protect our children. It has failed. The FDA has utterly and reprehensibly failed to meet the court deadline, and it is late by 2 years. So the FDA can and should act. I've also sponsored a measure, the PROTECT Act. The PROTECT Act would establish an anti-vaping program within the Center for Disease Control and Prevention. That's right, within the Center for Disease Control and Prevention, it's a disease, addiction is a disease, there would be a separate center to undertake a program that would stymie and stop more use of vaping and e-cigarettes, because this out-of-control epidemic simply has to be stopped. The government has an obligation. It already has the authority to take some initial action. And just to add one more point here, our neighboring states, New Jersey, New York, Massachusetts, have all banned flavors in e-cigarettes. Substantial reductions in e-cigarette use have been the result. That's proof positive that bans on flavors work. That ought to be immediately done by the FDA, the Food and Drug Administration, under a court-ordered deadline to act, which it has ignored. And we ought to come down very hard on the FDA, but also protect my PROTECT Act, pass my PROTECT Act, so that we provide even greater authority for stronger action by the CDC. So with that, I'll turn it back to you.
Thank you. So we will now have remarks from Congressman Larson, who's here with us today.
Nobody does it better or says it's stronger than Dick Blumenthal. And the FDA needs to be held accountable. We support his legislation in the House, and we join with Senator Blumenthal's efforts and the governor's partnership as well to make sure that we're doing everything that we can to stop these harmful things that are going on that need to be regulated and need to be forcefully regulated during this, as the senator described, unbelievable epidemic, not only here in Connecticut, but across the country. And as he said, when you look at our surrounding states and see what they've been able to do and see the results, it's past due for Connecticut to act, and also for us to have national legislation that's been sponsored by Senator Blumenthal. I'm proud to be here.
Thank you.
Thank you, Congressman. We will now have some remarks from Ruth Canovey, American Lung Association Director of Advocacy.
Well, good afternoon. My name is Ruth Canovey, and I am the Advocacy Director for the American Lung Association in Connecticut. And first, I really want to thank our great leadership that we have, who has had really continued commitment to protecting our public health, and for your tenacious leadership on tobacco control policy. So thank you so much for all of the work that you have done, and thank the Governor's Prevention Partnership for hosting us today and for all of the really important work that you do in Connecticut. So still in 2023, tobacco use impacts too many of us. It remains the leading cause of preventable death and disease in our country and in our state. 4,900 Connecticut residents die annually because of tobacco use. It costs Connecticut more than $2 billion every year. According to the CDC, e-cigarettes remain the most commonly used tobacco product among high school and middle school students. And in 2022, the CDC also found that the level of addiction among youth e-cigarette users increased, with over 42% of those who use products using these products for 20 of the last 30 days. This is not things that we've seen in the past. So the Lung Association is very concerned about the high levels of youth using e-cigarettes and also the level of addiction that we see. And frankly, it is indefensible that 7 years after the Food and Drug Administration deemed authority over e-cigarettes, that e-cigarette product sales increased 46% in the last 3 years, and that there was an increase in the number of brands, number of disposable devices, and flavored products on the market. For years, along with the community leaders and partners, the Lung Association has been urging the FDA to take meaningful action to both regulate the manufacturing and marketing of e-cigarettes. FDA must complete its review of e-cigarette marketing applications for all flavored e-cigarettes, including menthol-flavored products, as soon as possible, but no later than the end of 2023. FDA must protect our youth and end the youth vaping epidemic. In addition, the FDA must crack down on e-cigarette companies that have made quit smoking claims, as no e-cigarette has been found by FDA to be safe and effective in helping smokers quit. The mid to long-term health consequences of e-cigarettes are not yet known, as the products really have only been on the market for just a little more than a decade in the US. We do know that the impact on the lungs from inhalation of harmful chemicals in e-cigarettes can cause lung damage and lung diseases. There are resources out there for people who are addicted and to help prevent. And so to learn more, we certainly encourage people to go to the Governor's Prevention Partnership information, the Lung Association, and the state has some really important programs that help people quit. So I really want to thank you all for being here today, your attention to this really important issue, and to Senator Blumenthal and Congressman Larson for really your passionate and consistent leadership on these issues. These public health matters really are a detriment to our kids' health, and so thank you so much for your time and attention.
And Ruth, want to thank you again for those remarks. My name is Roland Harmon, co-president with the Governor's Prevention Partnership. We are an organization that has been in existence since 1989. Governor William O'Neill was our founder. And our first name was Drugs Don't Work. And so we changed our name because we began to expand our scope and our focus, becoming the Governor's Prevention Partnership. And the governor has always served as an honorary co-chair of our organization. Governor Lamont is the 6th co-chair for the organization. We are a capacity building organization, meaning that we provide training and technical assistance to prevention groups, community groups, also to mentoring programs across the state. And we hope that our efforts certainly empower programs in communities to serve young people throughout the state, helping them to prepare for a brighter future, also preparing the future workforce. We have been warning about the dangers of vaping from the very beginning and continue to push for common sense policy and prevention practices that keep these unsafe products out of the hands of those who are most vulnerable. We are a source for adults who talk and connect with young people on a regular basis, to talk with them about the dangers of drugs and alcohol. We have a newly launched website. You can find resources on our website, gppct.org. And it's cliché, but it's true, that an ounce of prevention is worth a pound of cure, especially when we're talking about nicotine. And as you've heard, it can be very addictive. So we encourage adults to talk to young people on a regular basis, consistent basis. They hear you. And so in terms of young people that are doing some wonderful things across the state, you're going to hear from them today. And Kaya Arana is here with us, and she's part of the Youth Advisory Board. And the statewide Youth Advisory Board is funded by the Department of Mental Health and Addiction Services. So Kaya.
Good afternoon, everyone. My name is Kaya Arana, and I'm a rising high school senior from Burlington, Connecticut. I am part of the Partnership's Youth Advisory Board, which is a group of youth prevention advocates from around the state who work together to develop prevention strategies for our schools and communities. I'm here today to speak on how the impact of flavored vapes on teens is an urgent matter that demands our attention. In the spring of my sophomore year, I created an anti-vape PSA with my high school's youth coalition. In this video PSA, there are about 20 to 30 youth coalition members who explain various reasons for why they didn't vape, ranging from them being too expensive, to students not wanting to ruin their health because they were athletes, and many more. While creating this PSA, I was shocked by how many youth coalition members were miseducated about the effects of vaping. Somebody in my coalition asked if vapes contain nicotine, and many more members thought that vapes weren't as harmful as cigarettes when vapes can be just as harmful, if not more harmful than smoking. How are we supposed to educate other teens on the harms of vaping when we were never properly educated on the harms of them ourselves? The introduction of flavored vapes, which are marketed towards teens, only worsens this problem. By marketing vapes as fun and trendy, it tricks these already miseducated teens into frequently using flavored vapes to fit in with their peers. Every day in school last year that I went to the bathroom, I was always greeted by a pleasant fruity smell. But this wasn't the smell of someone's perfume or body spray or somebody's lunch, it was the smell of vape. And the following conversation was one that I frequently had with my friends at school. When I went into the bathroom today, I could smell somebody vaping. Yeah, me too. We can no longer normalize the idea of teens vaping, especially in school. And we cannot let the flavored vape market reverse the progress that we have made towards reducing the vaping, smoking, and substance use rates among teens. Vaping especially can be so harmful to teens and can detrimentally affect everything about their lives, from their behavior in school to their future. Change needs to begin now by pushing vaping companies to stop marketing their products, especially flavored vapes, towards teens. Only then can we start properly educating our youth on the harms of vaping. And now I'd like to introduce my fellow youth advocate, Samantha Pa. Thank you.
Hello, my name is Samantha Pa, and I'm a senior at Haddon-Killingworth High School and a member of the Governor's Prevention Partnership's Youth Advisory Board. From my knowledge of my own school and in talking to others about their own, vaping is a widespread issue amongst middle and high school students. One of the main factors I've encountered while working in prevention is the access teenagers have to these products, especially with them being marketed towards them. In my own school, we have been fortunate enough to purchase a set of vape detectors. However, the cost to keep the detectors running is so high per year that they often do not run, and it defeats the purpose, and many schools can't even purchase these. Oftentimes, when you walk into the bathroom at school, you're hit with a fruity or candy-like smell. This is clearly a marketing tactic used towards teens, not adults, and it also makes teens scared to use the bathrooms at school, just because they feel like if I smell this, then if an administrator walks in, they're gonna get me in trouble, not the person actually doing it. I could not agree more with Senator Blumenthal's call to ban these products, which are obviously being marketed towards young people and fueling the nicotine crisis we are facing in the country. Thank you.
Any questions?
As far as the age restriction on vaping, is that the same as cigarettes? Is that the same?
It is, yes.
What is the Attorney General doing towards that effect?
I'm all in favor of stronger enforcement on age restriction, but I think, as with many restrictions on age, very difficult to enforce. And there are so many ways for young people to get hold of vaping products, even though they may be illegal for them to buy. What I want to see is cut down on the incentive, banning flavors. We need not ban e-cigarettes. We should ban the flavors. We should have stronger enforcement of the age limits. We should have more rigorous oversight in schools, and parents should take a stand. And for anybody who says, well, they're harmless, they're not harmless. They're addictive. For people who want to quit tobacco use, they may seem harmless, but we don't know the ingredients in a lot of these vaping products, which are sent from China. They have all kinds of carcinogens and other kinds of poisons that can mount in people's bodies and become, in effect, forever chemicals, causing all kinds of other diseases like cancer and diabetes and thyroid problem. So young people are playing Russian roulette when they begin with these products. And we can impose age restrictions, and we should, but let's make it less attractive by banning bubblegum, menthol, mint, strawberry, all kinds of flavors that attract kids and make it more fashionable.
students, generally the reaction you get when you do these efforts and programs, I mean, is it positive, or are you getting some feedback? Are you getting some feedback from some of your students like, oh, stop it, it's not that bad, or you're overreacting?
There's definitely mixed reviews. There's definitely some of my peers who have very positive outlooks on it and they're very supportive, but there's definitely also a lot of other teens that are like, oh, the work you're doing is dumb, like it's not going to do anything, or they're even like, oh, vapes aren't that bad, like they're not as bad as cigarettes, or at least we're not drinking in school and stuff like that.
So you got to kind of fight?
Yes.
Do you find that a struggle all the time?
It's a lot of a struggle, but I'm so grateful to have like a great supportive like youth advisor and a youth coalition that helps. But it's definitely very difficult at times to get people to actually listen to you.
And you definitely see an increase?
Yes.
In the use of it in your schools? Yeah.
Definitely. It's definitely the most commonly used substance, along with alcohol, that's being used in schools and outside of school by teens.
And the fruit ones more so than the non?
Oh, definitely the fruit ones. It's definitely, I feel like, more appealing to teens because it tastes like candy to them and it tastes like other stuff that they eat. And again, that's what we're always smelling. Like, I don't smell as much like vape smoke, I smell the fruity vape smoke. So.
If I could add, I think in my school, and especially in my town, it's harder for me because we recently had a smoke shop open in my town, and it has recently come out that they are selling to underage kids, even middle schoolers. They sometimes don't ID. If you say you don't have your ID, they just will give it to you. And so it's really hard because they can just ride their bike and buy it. And so there's so many kids in my school using, and they try arresting, oh, they're out on bond, next day they're selling again. So and we went through a point in my coalition where we didn't have a prevention coordinator in the school. So we were really fighting to get this problem solved. And then now I think this year we'll have a lot more programming in the school, but it's still an ongoing issue. And for me, I was the only kid in this club and working with the Governor's Prevention Partnership from my school. And so I was this lone voice trying to fight for this cause. So I think once we get more teens involved and this place shut down, or at least even if it's not shut down, a new employee, a new owner that will not sell to young youth aged kids, which is who they're marketing towards, I think that could change the way my school is and the kids in my school are, they look towards vaping and yeah.
Yeah, I was going to ask also for students and really anyone in general, sometimes I feel like students might feel as though they will get in trouble if they come forward saying they have addiction or access to these sort of things. What kind of direction do you point those students in who are maybe looking for help once they maybe come to you as a student or even as counselors at your school? What strategies have you found helpful?
Do you want me to? I have a couple things, if that's okay. So I can speak from the Lung Association's perspective. We know that kids have been targeted by the industry. And so we don't want kids to get in trouble. Even when we talked about the age restrictions, it's a sales age restriction. So the onus is on the people who sell not to sell to the kids. And that's really important. And so we have a few programs at the Lung Association, but point to others as well, that are an alternative to suspension program. There's one called In Depth. So we don't want kids to get in trouble. We want to make sure that they have the help available to them so that they have the resources to quit. And so happy to share additional resources, but we certainly encourage people to ask trusted adults in their lives to ask them for help. But there are resources. I know the State Department of Public Health just released vapefreeconnecticut.org if people can have a texting program and really have help to quit. And so really the onus is on the industry and not the kids who have really been targets.
These young people are really on the front lines. They're on the front lines because they're up against their own peers who are saying, in effect, you're not cool, you're not one of us. We owe them more support. And that is one key part of the effort that I am supporting, because we know from the tobacco wars that ads with sometimes a lot of humor can convince young people it's not cool. It's not good for you to use these products in the long term, and even in the short term. They're going to do you a lot of harm. And that will support efforts by young people themselves to reach out. But they are the most effective voices and faces that we have.
I know that my school and my district are very lucky in that we have a very established insight group. So anytime someone is caught vaping or drinking or using any substance, they're sent to this insight group, which is great. It meets every Thursday after school with our coalition coordinator, and they basically just talk and also get these quit kits, which I think is great because it doesn't put the blame on them. It doesn't make them feel like that they're in trouble. And I feel like what's also great about our school's insight group is that there's other peers there in this group too that aren't in trouble and they just want to support their friends. And I feel like that's a very effective way at reducing substance use rates at our school. But the problem is not every district has this. It's very difficult, especially to establish a very good insight group or to enforce kids going there. And I just think it's awful because a lot of kids then are in trouble. They get sent to detention or suspension, and this isn't an effective way to end vaping.
We want to thank you all for coming, and I think the latter part of this discussion has really been around how we support young people, right, and meet young people where they are and give them the tools and resources to really impact in their community. And so as another resource, one of the things that our organization does is support those youth groups that are working within the schools and within communities. We have a group called E3, Engage, Encourage, and Empower. And we will work with your school district. We will come to your community and support you and the young people that want to do the great work that Sam and Kaya are doing. And so it's about scaling, it's about replicating. Youth carry powerful messages when they're talking to their peers and can make sure that we get more information out about the dangers and harms of substances. So thank you all for coming.